Okay, it's just now 4:30. I'll check with the crew. Are we ready to start and broadcast on Facebook Live? Thumbs up, Paula, if we're ready to start. Okay, perfect. So welcome everyone to the Snohomish County Vaccine Town Hall. Council Chair Stephanie Wright and I have put this town hall together to help answer questions about the COVID-19 vaccine and vaccine distribution in Snohomish County. I want to give a special thanks to our co-hosts this evening, including the Tulalip Tribes, Representative Mike Sells, Representative Strom Peterson, Representative Emily Wicks, Everett City Council Member Scott Bader, and Mukilteo City Council Member Elizabeth Crawford. Today is March 2nd, and this event is being recorded for future viewing. It's also broadcasted on Facebook Live and online using Zoom. We have ASL and hard of hearing interpretation, and we'll have subtitle translation and the slides available in Spanish and other languages. Tonight, we'll hear from a panel of experts to cover topics related to the vaccine and distribution, and the second half of the program is to answer questions that people have submitted ahead of time. So if you have any additional questions at the end of the event, please feel free to email them or contact the call center, and we'll be sure to get back to you. So we'll put those emails and phone numbers in the chat section at the end of the meeting. So first, we'd like to hear welcoming remarks from Snohomish County Executive Dave Summers. So welcome, Executive Summers.
Well, thank you, Councilmember Dunn, and it's good to see everybody here this afternoon. Thanks for joining us. I'd really like to welcome you to this town hall focused on COVID-19 vaccine. I know it's been a long, hard year for many in our community. And as of yesterday, we've lost 540 residents of Snohomish County to the virus and have had 30,000 that have gotten ill with the virus. So I know in addition to the direct trauma and sickness, we've seen extraordinary suffering because of the economic consequences of the pandemic. People are out of work, going hungry, and fear losing their homes. And we know that that's been the reality for the last year. But happy to say, and I think we all feel it, we see a light at the end of the tunnel due to the incredible scientific work that's been done. We now have 3 vaccines approved for use in the US, and we've had 2 in the county, and we will shortly be getting the 3rd. So looking forward to that. We'll hear more about that. I'm really grateful for the scientific achievement, but I am incredibly frustrated by the lack of supply so far that the county and state have received. We've been told the supply will increase. It has been increasing slowly, and I want to assure you we are prepared for the day when we get an adequate supply. We have far more capacity ready to go to deliver vaccines than we have vaccines, but that's improving. And we know it's not been easy to find an appointment, and that's even for folks who have internet access and the ability to drive to one of our mass vaccination sites. So we are working, we recognize those difficulties that many people have, and we're working just as quickly as we can to alleviate those problems. Certainly, if we had more supply, that would be less of a problem, but we're working on it, and we know the difficulties. The vaccine is really the best, most direct way out of this pandemic. Once enough people get vaccinated, we can once again safely open our economy and start to ease the suffering. Snohomish County's response to the pandemic has been robust collaboration with many partners, including the County Council. Thank you so much for their partnership. The Snohomish Health District and many local, state, federal, and tribal leaders also. So the collaboration has been outstanding here in Snohomish County. In particular, I want to thank Chair Wright, Vice Chair Dunn, and the other members of the County Council for their leadership during this unprecedented time. We've had to do things larger and faster than ever before, and the County Council has been great. And thank you, Chair Wright and Vice Chair Dunn for that. They've been really helpful as we set up our mass vaccination sites, our quarantine sites, get their PPE, all the other elements of our response. But they've also helped us get prepared for post-pandemic life in other ways. A good example, Chair Wright and Vice Chair Dunn worked to ensure Snohomish County's public facility districts in Linwood, Edmonds, and Everett receive CARES Act funding so they'd be able to safely open as early as possible. So it's taken leaders at every level and a very, very resilient and cooperative public to get us through what I hope is the worst of the pandemic and prepare for what comes next. So our residents have pushed down the curve 3 times. Our hospital capacity was never overwhelmed, but it was pushed to the brink, to be honest. We're just grateful for all the sacrifices and hard work of the thousands across the county to get us to where we are today. We've got some hard work that remains. We're going to stay focused on quickly and safely vaccinating everyone in the county who wants to be vaccinated. So thank you again for being here tonight. With that, I'll hand it over to Chair Wright.
Thank you, Executive Summers. So I really appreciate everybody joining us this afternoon. I was looking back and I realized exactly on this day a year ago, I had scheduled our first town hall to reach out to our city partners and the community about COVID-19. It's been the longest year ever for all of us, I think. So at that time, we wanted to share what we knew and answer questions and prepare our community for what we foresaw potentially coming our way. Since that first meeting, we have worked through so much together as a community. So as this event unfolded this time last year, our first challenge was providing mass community COVID testing. Because of the determination and creativity of the team, within a month, we were opening one of the very first drive-through testing sites. That same team that put together those first testing sites last year, and I just have to stop and say literally put together, from putting out the cones, putting up the tents, sourcing umbrellas, all of that, from those people there, these are also the ones that helped plan and open our first mass vaccination sites earlier this year. And to me, they're heroes. This was all possible because first, the Snohomish Health District and Department of Emergency Management has an amazing staff that I will be forever grateful to. And second, our community partners and stakeholders, our cities, our fire authorities, our nonprofits, and numerous organizations that have stepped up and been part of the solution. We want to thank you all. Our community partnerships were the strength that we identified last year. And this has been the strength that has been carrying us through one of the most uncertain times in all of our lives. And because of that, we are so fortunate to live in Snohomish County. So before I get emotional, I'm going to wrap up, but I just want to thank you all for joining us this afternoon. And now it's my honor to hand it over to our health officer, the reason most of you have joined us today, Dr. Spitters.
So let me actually interject. We're getting some requests from media to record. So if you are with the media and wanted to record, we're using the webinar format. So we'll have to move you over to be a panelist. So if you've got your credentials in your name, you can raise your hand, use the raise your hand function, and we'll work on moving you over. So if only media could raise their hand right now and have it identified what outlet you're with. And now we'll turn it over to Dr. Spitters, health officer with our county health department. Thank you.
Okay, good afternoon, everyone. Thank you, Council Member Dunn, Chair Wright, Executive Summers, and the rest of the team. Thanks for joining us today to talk about COVID vaccine. Just going to get my screen control here under. There we go. Just getting my screens arranged so I can see what I'm doing. Thanks for your patience. So before talking about the vaccines, I do just want to take a minute here at the start to provide an update on the broader COVID-19 situation in Snohomish County. You go to the next slide. Thanks, Heather. This graph is quite likely familiar to you by now. It's our rolling rate of COVID cases per 100,000 residents over a 2-week period. So each data point there is the end of a 14-day period over which all the cases are added up and divided by 8.3, which is, we have 8.3 100,000 people in the county. As you can see, we've had about 6 weeks of declining rates since the peak back in December. The case rate has now come down 75% off that peak to 109 cases per 100,000 for the 2-week period ending Saturday, February 27. However, it is important to note that the week-over-week decrease is slowing down. You can see that curve starting to flatten, and this is cause for concern because although the trajectory downward is great, the absolute level of transmission is quite high. You can see as comparing it to the prior two waves we saw earlier in 2020. So we're still far short of what we wish to accomplish. Case counts updated today show that more than 31,000 Snohomish County residents have had a reported confirmed case of COVID-19. 29 residents were still in the hospital today with COVID-19. As Executive Summers mentioned, that number was much higher, ballooning up toward 120 just 6 to 8 weeks ago, but has come down with the decrease in transmission. So now just down to in the high 20s every day, the number of people in the hospital with COVID. Right now, 4 of them requiring mechanical ventilation to breathe. And today marks 1 year since the first Snohomish County resident lost their life to COVID-19. And here we are 1 year later with 540 additional lost loved ones, friends, and neighbors due to COVID-19. It's easy to feel like we're on the other side of this and we're all tired of COVID. And the decreasing numbers are cause for optimism and hope, as are the vaccines arriving daily, but we cannot let up on the prevention measures that are the backbone of our effort to curb this epidemic. Now is the time for buckling down and following all the public health measures, washing your hands, wearing a mask, watching your distance. Every time, every outing, every get together with friends or family that you don't live with, and do this even if you've been vaccinated. Think of the vaccine like your bicycle helmet or seatbelt. It doesn't eliminate the risk of injury, or in this case of getting sick, but it does significantly reduce it. All of this is incredibly important when we look at the potential impact of variants spreading in the county. Speaking of which, next slide. So this table just shows you in the left column the different variants. So these are strains of the virus that have developed mutations that make them distinct from other groups of the virus. And like any living organism, this virus is constantly changing, and viruses that mutate and have those mutations give them a competitive advantage. They do better, and they will start to displace the others. So you may or may not have known back in the spring and summer of 2020, a new strain initially connected to emergence in Europe arrived in the US and is now responsible for most of the infections in the US, that DG614G strain. Don't worry too much about the names of these strains. It's the principles behind the names that really matter. Now that one did outcompete the previous strains, and it's largely what's circulating now in the US. Recently in the United Kingdom, a strain called B117 emerged and is now responsible for the majority of infections there. Surveillance here in the US suggests that it's in Washington state probably at or near 1%, but likely to increase. And it is anticipated to replace the other dominant strains in the community probably within 3 to 6 months, unless another strain comes along that's a better competitor. Now, increased transmission on its own can be a problem because if there's a higher transmission, it's harder to interrupt that transmission, and so you get more cases, and then we could end up going back to where we have more hospitalizations, more cases in long-term care settings, more deaths. So this is serious, and we want to pay attention to it, and it's another reason to double down on our prevention efforts. With that strain, there's some mixed information, mixed data about whether it's more severe or not. That's still being looked at, and that may well be the case. In terms of immunity, it's decreased a little bit. Immunity gained by prior infection or by vaccination in the test tube does a little bit less good of a job killing the virus But in humans, recent vaccine trials, including the Johnson & Johnson vaccine, which I'll mention in a minute, had very good efficacy in the human body in preventing the outcomes that we're trying to prevent, even in countries where these strains are circulating greater. So we don't think that the B.1.1.7 is a threat to the vaccine immunity. B.1.1.3.5 emerged, we think, in South Africa. It's finding its way to a lesser degree around the globe. It too has increased transmission potential, unknown about whether it causes more severe disease. In the test tube, again, antibodies from people who have had COVID or who have been vaccinated for COVID are less effective in stopping that virus in the test tube. But again, that Johnson & Johnson clinical trial that included South Africa as a site showed equivalent efficacy across the US and South Africa. So it appears that strain, although in the test tube, is a challenge for immunity. It's not in the human body with the current vaccines available. And then the last variant of concern I want to mention is one that emerged from Brazil. It too is going to find its way around the globe. We don't know how well these three will compete with one another, but that's the current situation. And it's just a call for us to remember that these are different areas of the virus's impact: transmission, severity, and immunity, the different areas of impact that a new virus strain can have. And so again, it speaks to the importance of us, one, trying to do everything we can as individuals and society to reduce transmission, because these might be a little bit easier to spread around. And then for our partners in the scientific community to, much like they do with influenza vaccine, going forward, there will probably be efforts to update the vaccine over time to reflect what the strains that are circulating look like. A couple more notes on these strains, just to note that we've had 2 cases of the B.1.1.7 identified in Snohomish County, none of the other 2 that I mentioned. The State Department of Health currently is conducting surveillance of about 2% of total specimens collected, or positive specimens collected, looking for these strains. Their goal is to ramp that up to 5%. They can't do it on every one, but they do want to have a little bit more robust surveillance capacity. So the goal is to get 5% of all positives tested at the state health department. So again, the key thing around these variants of concern is to continue the prevention efforts: washing your hands, wearing a mask, watching your distance, avoiding gatherings, and then when it's your turn, get vaccinated. So let's talk a little bit more about the vaccine and how it's being prioritized. This slide breaks down the current phases and tiers for prioritization as set by the Washington State Department of Health. We are currently vaccinating those eligible for phase 1A and 1B1. It's also important to understand that where people currently land in the prioritization and the phases is not a reflection of their value in the community. If we had unlimited vaccine supply and clinical capacity to administer all the vaccine, prioritization would not be necessary. But right now, supply is really a problem, and so we've got to prioritize the limited supply as it goes out. And so this is why, until vaccines start flowing more into Washington and Snohomish County at higher and more predictable pace, there's a need to prioritize the limited capacity. And again, this capacity is not necessarily directed at those who are at higher risk of acquiring COVID, but rather for those who are most likely to become severely ill and require hospitalization or die. Because that's you recall in this third wave and in the first wave, it was the hospitals filling up that really spin things into an emergency. So these phases and these tiers in this vaccine prioritization scheme reflect the work of multidisciplinary teams working at both the federal and state level to maximize societal benefits, support essential functions of society, and address inequities in access to services. This work has involved medical scientists, social scientists, ethicists, and outreach to community stakeholders. We estimate that roughly 200,000 people are currently eligible under phase 1A and 1B1. Now, while most people in phase 1A have been vaccinated, we think we have around 80,000 people left in phase 1B still trying to get an appointment. Jason and Sean will talk more about supply and demand in a few minutes, but for those asking when we'll move to the next eligible group, our numbers needing to be vaccinated in the current 1B1 group suggests that it will at least be several more weeks before we would look into advancing to 1B2. I also want to mention, some of you may have heard the announcement from President Biden this afternoon. He shared that by implementing the Defense Production Act, they believe there will be enough vaccines to vaccinate every adult in America by the end of May. This is a acceleration from the prior estimate of having an adequate supply to cover all adults in the US by July or August. And again, I would just mention that that's to secure a supply. We still have to get that into arms, and that's going to take time. President Biden also called on 50 states to work to ensure that every educator, school staff member, and childcare worker receives at least one dose of vaccine by the end of March. This was all just announced today, so we don't have a lot of details. This prioritization might be adjusted slightly to reflect that, so stay tuned. I also recall the president's comments mentioning that the venue for that school teacher intervention may be the federal commercial pharmacy connection. So stay tuned for developments on the details of this emerging opportunity for our educators and school staff. Next slide. The Snohomish Health District published its first vaccine demographics report last week. I'm going to share just two pieces from it, but you can find the full report online at www.snohd.org/case counts, all one word, under snapshots and reports. Here we see a breakdown of vaccines administered through February 14 by age group. This is countywide. We see that roughly 1 out of every 2 vaccines given is going toward those age 65 and up. And overall, 31% of Snohomish County adults that are 65 years of age or older had been vaccinated by February 14. We anticipate this number increasing significantly when we update the report again later this month. Next slide. When looking at race and ethnicity, the highest vaccination rates, so these are number of vaccines, number of people vaccinated per 100,000 residents in that group. So the highest rates have been in Native Americans and in Native Hawaiian Pacific Islanders. This is good news, as these two groups really have been disproportionately impacted by COVID-19. The data show that the Native Hawaiian Pacific Islanders have the highest case rate of COVID infections in Snohomish County, which was over 5 times that for non-Hispanic whites. Hospitalization rates were also higher for Native Hawaiian Pacific Islanders, American Indian, Alaskan Natives, and Latinos. And death rates were 2.5 times higher for Native Hawaiian and Pacific Islanders. So, in summary, COVID has disproportionately affected the racial and ethnic minorities in our community. And so it's, on the one hand, it's good to see higher vaccination rates in those two groups on the right of the slide. African Americans and Asians are just about 90% of that in non-Hispanic whites. And then we see a big drop off in Latino vaccination rates, being just about 40% of what we see in non-Hispanic whites. Now, part of this is due to differences in the age distribution of different groups. For instance, in non-Hispanic whites in Snohomish County, about 20% of the population is 65 and up, whereas among Latinos, it's only about 5%. So some of the lower vaccination rate per total population just reflects a smaller number of, in this case, Latinos who have reached a point of being eligible and able to get the vaccination. But still, the gap is so large that it raises concern that there are differences that may be due to trust or access to the vaccine. And we'll be working with partners in Snohomish County to see that gap close as vaccination efforts progress to include essential workers and other phases moving forward. Next slide. Just like to talk a little bit about the vaccines now that have an emergency use authorization from the Food and Drug Administration and corresponding clinical recommendations from the Centers for Disease Control. The Pfizer and Moderna mRNA vaccines, meaning they use messenger RNA technology to deliver a bit of genetic code to the cells. What messenger RNA is it's a product made from the genes. It's basically instructions from the genes for the machinery in the cell to make proteins. Sometimes that protein is muscle or bone. In this case, it's the spike, the protein on the surface of the virus, which is a main target of the immune reaction to COVID, and that can provide immunity. So what they do is they put that code inside some little spheres of fat, basically, and then put that in a vaccine, and that gets injected. And then the human cells take that message and make the spike protein, and the immune system responds to that spike protein and retains a memory of it. And then that's vaccination. The new Johnson & Johnson vaccine uses a slightly different approach, but it's the same net result. Instead of putting that messenger RNA inside a little fat sphere that's microscopic, and then there's millions and billions of them and they get injected, they take that code and insert it into the genetic code of a respiratory virus called adenovirus that does infect humans. They've also taken that virus and made sure that it cannot replicate, can't grow or cause disease in the human. All it does is it gets injected. It then enters the human cell because it's able to infect human cells, but it can't reproduce. It opens up, and then that code from the COVID virus that was put in there by the vaccine makers is then taken up by the human cells, and the same process occurs where the human cells make that surface protein. We develop an immune reaction to it, retain memory of that immune reaction, and so that when we see COVID in the future, we attack it and kill it before it makes us sick. So the key differences between the two vaccines, the major one is that the new Johnson & Johnson one is a single dose. We don't have any of that in Snohomish County yet, but I look forward to us making use of it as it comes. And the Pfizer and Moderna vaccines are 2 doses, 3 to 4 weeks apart, depending on which product. They're all only recommended for adults, or in this case of the Pfizer vaccine, adolescents 16 and up, and adults. Okay, next slide, please. Now, some of you may have heard in the news that the Johnson & Johnson vaccine, which was, again, got emergency use authorization from the independent panel of the Food and Drug Administration, that it is a safe and effective vaccine, and the Centers for Disease Control and Prevention reviewed the same data and made recommendations for endorsing its use in adults. Now, some of you may have heard that the vaccine has a 66% efficacy rate and might be concerned because you also might have heard that the Pfizer and Moderna efficacy is up around 90–95%. So I just want to, reassure you that this is a safe and effective vaccine, and it will be and should be a key part of our emergency response to COVID-19. It has excellent efficacy in preventing severe disease. 85%, up around where Moderna and Pfizer are. There were hospitalizations were greatly reduced by 90% within 14 days after vaccination, meaning that the people who got the placebo or the fake vaccine, no vaccine, that's one arm of the clinical trial, and then the people that got the Johnson & Johnson vaccine, they had a similar experience in terms of acquiring COVID and getting hospitalized for about 14 days. And then the line split. Once the immunity kicks in, hospitalization was down 90% after 14 days and 100%, no hospitalizations in the vaccine group after 28 days. And in the placebo group for this study, 7 deaths in the placebo group, 0 deaths in the vaccine group. So again, just more information to try to make it clear that this is a safe and effective vaccine and will help us in our effort to prevent all the things that COVID has caused in our society. With the Johnson & Johnson vaccine now authorized, we have started receiving questions on how people can sign up to get it, or if it's possible to get on a waiting list. Right now, we don't know exactly when doses may arrive in Snohomish County, and similar to when Pfizer and Moderna were authorized, it takes a while to get production up to full steam and to get a distribution network going. Again, President Biden announced today that Johnson & Johnson is expanding production to 24/7 and partnering with Merck, a former competitor, to help get more doses out. This will take time, so Johnson & Johnson's supply will likely come into our county in increasing numbers over a few weeks. In general, the best vaccine is the one you're able to get. They all are safe, they're all effective, and they're all authorized and endorsed by independent bodies. These bodies I've mentioned that review the data and advise the FDA and CDC are independent. They're not employed by FDA and CDC. They're independent vaccine scientists, medical doctors, epidemiologists, and a variety of other disciplines. So while you may have a preference on which vaccine you would like to get, it's best not to wait if another vaccine brand is available sooner, unless you've talked to your doctor and there's some medical reason to avoid a particular brand of vaccine. And frankly, I can't think of that right now. So that brings me to my last reminder. The vaccine is incredibly important, and we want everyone who can get it to get it. But it's also not a free pass. People should still proceed with caution, particularly if everyone around us is not fully vaccinated yet. It's also important to remember that vaccines are still not available for those under age of 16. I know people are anxious to see their loved ones and give them hugs and get together again, but we're not out of the woods yet. We need the vaccine supply to pick up more so that we can get a larger proportion of the population immunized. And when we have 70 to 80% of the county and state and nation immune, that will probably be enough to where the virus will, bump into too many people that are immune and stop spreading. Until then, we need to do all that face masking, hand washing, distancing, keep our social bubbles small, and remember, when gathering, outdoors is best, and keep it short. So this isn't all forever, it's just for now, but we really appreciate your support in all of this. And I remind you to stay up to date on the latest information from the Health District around COVID-19 and vaccine. You can sign up for our press releases and blogs and follow us on social media. So with that, I'll turn it over to Jason Biermann.
Thanks, Dr. Spitters. Thanks, Chair Wright, Vice Chair Dunn, Executive Summers. Thanks, everybody, for joining us. I'm Jason Biermann. I'm the Director of Emergency Management for Snohomish County, and I'm honestly very honored to represent the county's vaccine task force. The task force itself is comprised of lots of different partners, the Department of Emergency Management, the Snohomish Health District, various fire agencies from throughout the county, healthcare providers who have worked with us, human service providers who have worked with us, private sector partners, nonprofit partners, the Boeing Corporation, lots and lots of folks who are who are really working together hard to try and get vaccine out into our community as quickly and safely as we possibly can. Next slide, please. So the folks who are doing this work actually started working on this quite a while ago. And here's some of the key points of what this team has accomplished. We received our first vaccine into the county a little over 2.5 months ago, and have already, through the work of lots of different partners, provided vaccines to over 130,000 folks, or 130,000 doses that have been administered. 30,000 of those people who have gone through the process are now fully vaccinated. It notes there that that's enough to fill the Angel of the Winds Arena 3 times over. It's approximately the size of the city of Lake Stevens, a little bit less. It's a lot of people that have gotten vaccinated very quickly. We did this in partnership with our healthcare system. I want to thank the team, honestly, that was given the challenge of trying to figure out how we could really augment and support our healthcare system. The challenge they got was pretty significant, and that was to provide a high capacity, high throughput way of getting as many of our residents vaccinated as quickly as we possibly and safely could. We do have significant capacity. My initial goal, our initial goal was 50,000 residents per week. We believe we have that capacity now if we have the number of vaccines, enough vaccine to actually utilize in our existing sites and the sites that we have planned. We know that the priorities to get folks who are most at risk, as Dr. Spitters mentioned, to get them vaccinated, but our goal is truly to get everyone who wants to be vaccinated, vaccinated as quickly and safely as we can. I've heard the frustrations. I know Executive Summers mentioned some, Chair Wright mentioned some. I hope folks will understand that we are working in a pretty dynamic environment. Even as we've had, just before this started, even as we've been in the process of doing this town hall, there's been a change to the guidance. Dr. Spitters was talking about phase 1A and phase 1B1. The governor's released a statement saying that educators pre-K through 12 and childcare workers will now be eligible under phase 1B1. So we'll pivot quickly with the capacity we have. We'll do our everything we can within our power and our utmost to make sure that all those folks are now who are now able to get vaccinated, that we can incorporate them into this. But quite honestly, that last bullet points is of really the greatest importance. Our biggest challenge is we simply don't have enough vaccine right now for all of our sites. Next slide, please. So the task force had a number of sort of tenets that it worked under as we move forward. Of course, we wanted to coordinate all of the vaccine sites and work with all of our partners. We recognize that the mass vaccination sites and the mobile capability that we're developing is just part of an overall puzzle, that our healthcare providers, our clinics, hospitals, and others are all part of this effort. And we just wanted to make sure there was coordination among all of us. We started doing this and working with the healthcare providers, going again all the way back to late July, early August, that they would be at the forefront as they have been throughout most of the COVID response. So there was an effort made to ensure that we could support them. We wanted to prioritize our most at-risk populations. We wanted to make sure we stick to the policies established by the Department of Health, and that we could do whatever we could to connect what resources we could bring to this effort to our long-term care facilities and other marginalized communities that have been hardest hit by COVID. And then an enormous part of this effort is providing timely information. Dr. Spitters mentioned the Health District's website. We have what we call a community hub, another website where folks can get information. Those two websites are linked. We provided numbers of updates to the public, to elected officials, and to others throughout the community to try and make sure that as fast as we have information, we can provide it to you and update you so you have the information that we have as quickly as we can get it to you. Next slide, please. So some of the highlights, like I mentioned, we began planning back in late July. We began planning really honestly kind of on the premise that mass vaccination might be something we have to do, but with the idea that our healthcare system would take on as much of this effort as it could, and mass vaccination, again, would just be a part of that. We obviously had to start utilizing that. And then on January 6th, we opened the first of our mass vac sites at Payne Field. We've since opened sites at Edmonds College, at Monroe Fairgrounds, at Arlington Airport, and have moved the Painfield site to the Boeing Activity Center. Like I mentioned, all of this work is the result of a lot of cooperation, a lot of coordination and collaboration. And honestly, it spans government and the private sector. And it's been pretty incredible to watch the effort that's gone into it and see the results that are coming out of it. So coming into March, we do intend to open additional sites. We are certainly looking forward to additional vaccine arriving, and with the president's announcement today, are hopeful that it will start arriving in much larger quantities fairly soon. But to talk about exactly the vaccine itself and the vaccine's arrival into the county, I'm going to turn it over to Sean Frederick, the Health District's administrator.
Apologize, everyone, I froze for a second. I want to thank everyone who took time to be here today. Thank you to obviously Executive Summers, to Council Members Dunn and Wright, to Dr. Spitters, to everyone that's been involved in this process. It has certainly been a journey over the past year. We've had several challenges, beginning with, as was earlier mentioned, standing up testing sites, lots of other activities, doing community outreach with employers, going to all different areas and aspects of this response, and we're finally here at vaccinations. So, as Jason has already mentioned, a lot of the activities that are going on, the timeline. Just kind of want to talk about where we are. These numbers are slightly different than when you saw earlier. The beauties of slide development. We are truly at about 130,000 doses that have been completely, that have been administered, with about 30,000 people being fully vaccinated. So right now, about 76 to 80% of our vaccine has actually been fully distributed out into the community, which also means shots in arms. That's really based on the overall eligible population of about 638,000 out of our 830,000 residents here in Snohomish County. Again, as was previously mentioned, both by Dr. Spitters and Director Biermann, there are links available on this slide that actually point to both the Community Hub page and the Snohomish Health District page. Next slide, please. So kind of want to talk about some of the modalities used to get vaccine out into the community. Obviously, the most visible piece of that are the mass vaccination sites. And we do have a map here in a slide coming up that actually details where those sites currently are located. But it also involves our primary care providers, our healthcare systems, be it our 4 local hospitals, other healthcare providers, both large and small in terms of private practices, community health centers, FQHCs, and others, all working together with their individual populations. Pharmacies, both through independent action here in coordination with county efforts under the Vaccine Task Force, or through multiple federal programs to partner with our long-term care facilities, or to be able to provide a vaccine directly to our communities. Lastly is the Agile vaccination capability. So really being able to get vaccine to the community where people are. That's been particularly important for our adult family homes, for some of our long-term care centers, and really working with some of our populations, like the BIPOC community, really making sure that we have partnerships in place to be able to bring vaccine to the community in a meaningful way. Next slide, please. That doesn't mean that there aren't challenges in getting vaccine out into the community. The biggest one is obviously the availability of supply. Supply drives the number of appointments that are ultimately available. They drive the strategies that we can employ at any given time. When we want to, maybe we want to increase the number of mass vaccination sites, or be able to increase the number of mobile activities. So that vaccine supply is really important. Being able to meet the technological challenges. We know that we receive lots of feedback around challenges in both appointing for first doses as well as appointing for second doses in some cases, and we're working to improve that. Some of those things are bringing on board state systems that improve things like vaccine management and registration systems. Some of those things are working together with other partners to put in processes to overcome technology gaps. A great example of that is working with our call center to collect contact information when necessary, and being able to get that to other healthcare partners who can then do outreach to those individuals who have those challenges. We're also looking at other ways that we could expand that capacity to help people overcome those technology gaps. Dr. Spitters had several graphics on understanding the equity distribution of vaccine in the community. There are efforts that are community organization led to really try to get vaccine again where those communities are. We've been fortunate to be able to participate in some of those activities and be able to provide vaccines so that those clinics are supplied and able to do that work again, working with equitable distribution as a focus lens. One of the biggest challenges that we frankly had to deal with is combating misinformation and rumors. One of the biggest causes of frustration for the community is a lot of information that's being put on social media that's either purposefully or inaccurate or misleading, or in some cases incomplete. That becomes a challenge because people are spending inordinate amount of time trying to get appointments, and in some cases sharing vouchers or what they believe to be appointment slots that ultimately aren't going to be supplied because there isn't enough vaccine when those things occur. And that only increases frustration and miscommunication in the community. And that's something we actively work towards combating on a regular basis. Okay. So here on this slide, you can see the location of our current mass vaccination sites. 2 of the sites are currently drive-through. Actually, 3 sites are drive-through. Edmonds College, the Monroe site, and the Arlington Airport location are all drive-through vaccine sites. And the Boeing Recreational Center represents our one fixed facility site currently. What you see, oh. No, we can go to the next slide. So again, to stay informed and make sure that you have the right source, I want to recommend that everyone either follow the Community Hub website listed here at bit.ly SNOCO vaccine, or the Health District's website, snohd.org, COVID vaccine, and make sure that you have accurate information and stay current on guidance as it becomes available. It's been well said that this is a very dynamic situation that we find ourselves in trying to get vaccine out. In fact, the guidance has changed literally in the time of this town hall. So with that, I will turn it over to Rochelle.
Thank you. Good evening, everyone. I know a lot of this has already been covered and I don't want to repeat anything, and I really want to honor time for questions because I think that's what town hall is really about. I'm just going to cover anything I have that hasn't been talked about already specific to Tulalip tribes. So we have vaccinated almost 10,000 people by the end of this week. Out of those, 30% of those are tribal members. We're really working on getting more tribal members in to get their vaccine. There's some mistrust issues and some of the same facts that we're finding on social media that people run into. So that's a challenge of ours, but we are working in lots of different ways to promote the vaccine and make sure we're getting those shots in arms of our tribal members. I'm just thinking on the top of my head of things that people are curious about. I know we got a lot of press for vaccinating the Marysville School District. We finished the second dose last week. And so our Marysville School District team members that wanted to be vaccinated have now been vaccinated and had their second dose as well. We're also going to get geared up to vaccinate the Granite Falls School District next week. They have reached out and we have a lot of partnership there that we're going to honor and vaccinate their teachers. Prior to doing the school district, we followed all of our own priority groups similar to the priority groups from the state and modified based on our own community. And so we started with our tribal elders, of course, and then we moved on to immune compromised and worked our way down the list till we offered it to every tribal member. After that, we vaccinated our other natives in Snohomish County. That's something that each of you and your partner groups should know, that we will vaccinate people from other tribes or from Alaska Nations at our clinic in Tulalip. And we've also, let me look at my list. The school districts. The next thing we want to do after the school districts is offer the vaccine to the elderly that live on the reservation who haven't been serviced by their own healthcare providers. So we'll be putting out information in the coming weeks about that opportunity for people who live on the reservation. We'd like to take care of them because I know it's been hard for people to access through the chains that you've already been talking about. So we're ready to do that as well. We have had 318 people in our community be positive for COVID-19 since the beginning of COVID. And sadly, our first elder passed away on March 19th of 2020, and we've lost 7 elders since the beginning of COVID. And in a small community like ours, it's a lot of elders to lose in 1 year. We lost others, but those to COVID alone. And so that's been a significant loss for our community that will take a long time to overcome. And like other people who live in small cities in Snohomish County, you'll know that you know everybody. So that's a lot of funerals to not be able to have, a lot of gatherings not to be able to have, to heal. And so that will be a lasting impact of COVID for the Tulalip tribes. And so that will be something we'll be working through for a long time. And once we're able to gather again, we're going to find ways to honor every single one of those families who lost their loved ones, and we're able to spend that time together to heal and grieve the loss of those loved ones. I guess the only other couple things I'll reference so we can get to questions is we've had community health nurses in Tulalip tribes go out to homebound residents who can't come to our vaccination clinic to get their vaccines. That's another victory that we've had. And another challenge outside of the vaccine quantity is that all of our healthcare workers from our community clinic are running our vaccination clinic, which means our people aren't able to get to their primary care appointments the way that they should be. And then there's a loss of revenue due to that. So we've been looking at ways to use the relief funds from the federal government to be able to backfill those budgets, but that's a huge loss in Tulalip. All of our physicians and nurses and medical assistants are running our vaccination clinic. So those primary care services have really taken a hit during this time. So that's something that we're going to have to work on as well. But I really want to honor those questions. Thank you for having us. The Tulalip Tribes has been a partner. We want to thank the partnership with Snohomish Health District and Emergency Management and really the state for honoring our sovereignty and being able to decide how we use vaccine in our community. It's been a game changer, and it's a really healing opportunity with the health inequity that's happened for generations and generations for us to decide how to take care of ourselves and our people. So we'll be really grateful for that for a long time. So thank you, and I'm done.
Thank you, Rochelle. So we shared questions in advance with the presenters so they'd be better prepared, and some of the questions were addressed in the presentations, but we'll move on to some of the specific questions that were sent in. And if you have, if your question did not get asked, we'll have a number to call, or you can also always email us And we can also go a little, we're a little bit behind, so we can go a little bit past 5:30 if that's okay, and continue to ask some of these questions. But one of the most common questions we received was about reaching marginalized communities. So I was going to ask Jason and Rochelle to answer this. But Ed sent in a question and asked, what exactly has Snohomish County done, and what exactly is it doing to ensure that marginalized communities, defined as communities of color, lower economic communities, and others who do not have resources to technology, are able to get the vaccine? So similarly, Paula also asked, what about BIPOC community leaders, and how are you helping older people without internet and with other limitations? So Rochelle, if you could address that first.
I mean, in our community, I think that's something great about local communities responding is they know how to communicate to the populations who are at greatest need. So in Tulalip, we have a lot of unique ways, is what I'll call them, of communicating with our community members, which creates a really efficient way to move through our priority groups as well. So what we have done is we have also honored household members of our tribal members the opportunity to get the vaccine. These are already going to be low income, marginalized populations living within our reservation in the households of our tribal members. And so we have extended that opportunity to these folks without we don't need a lot of documentation. We're going to trust our tribal members that their household members can be served in our community, and then we're flexible where we need to be. And when somebody comes in from one of these communities and they have a connection to the Tulalip community, we're going to vaccinate them. And that's something I didn't mention earlier is we want to continue to be a partner in vaccinations as the increase and the supply increases, that we can help you with the school districts and the people in your priority groups that we haven't been able to help you with yet. We're here as a resource for that as well. And our tribal board has committed to that.
Thank you. Jason, do you want to add more on specifics, what the county's doing for outreach?
Sure. Briefly, there's a lot. So I'm going to touch upon some of the things and I'm happy to expand. It started, of course, with the planning, but most prominently back in February on the 11th, Executive Summers, Dr. Spitters, myself, and a number of others met with key community leaders who represent those communities that are most adversely impacted by the pandemic, so we could hear from them what thoughts they had, what concerns they had. That led really quickly, honestly, within a couple of days, to having a clinic where there were a link for registering folks who were in those communities was shared sort of as a closed link, so that marginalized communities were able to have equitable access to that vaccine. There were about 1,700 folks that day who qualified under the eligible criteria, but from marginalized communities that got vaccinated. The health district and along with the county provided about 400 vaccines to Providence Regional Medical Center to help with BIPOC-centered clinics. Those are specifically to target the BIPOC communities and other marginalized community members. We are working closely with the Executive's Office of Social Justice to create and launch a community advocate program. That will be similar to what was done during the census work, in which BIPOC-led organizations will go out and have representation and be able to connect with community members, provide language support, and assist with registering people for their appointments. The health district and I are working, and us, DEM, are working with our transportation providers to identify transportation resources that can be made available to them so that they can make it to the mass vaccination sites. We're conducting a community-based mobile clinic with Homage Senior Service. And then last, and there are more, but last, we've greatly expanded our call center capability, both in terms of sort of quantity, the number of folks who are taking calls, but also in partnership with Vancuno and some other folks to have direct access for people who do not speak English as their primary language, so they can reach out to folks who can speak directly to them so they don't have to wait for translation services. Whew. I tried to get through that quickly. There's more, but yeah, quite a bit.
Thank you. The next question is for Sean. What supervision does Snohomish Health District have over the distribution of vaccines to agencies and then subsequently offering that to the community?
So this is kind of a two-part question. There is the normal vaccine role, and then there is the COVID vaccine role. So I will start with the normal role of vaccine distribution in the county and what the health district's role is. Primarily, our role as part of our vaccine preventable disease program is to work with all the registered vaccine providers, not just here in Snohomish County, but actually across 5 counties. What we do is make sure that vaccine is properly stored, managed, ordered, and inventoried, making sure that those healthcare providers are distributing those vaccines that are primarily part of the Vaccine for Children program are properly managed and utilized. Specific to COVID and vaccine distribution, there's 2 different roles. There's a few different roles here, so I'll go into them. For agencies, and I do understand that this question has kind of a specific incident tied to it. For healthcare providers that have independently contracted with Department of Health to be vaccine providers, they are ordering that vaccine directly through Department of Health. And our role is primarily supportive of them. There are regulatory components in terms of reporting and obviously compliance with the governor's guidance that is managed by Department of Health through their reporting system. For the mass vaccine sites, we, as someone who is involved in providing, transferring some of the vaccine in support of those activities, we provide a little bit more direct role there, making sure that those vaccines are being used appropriately. However, we don't generally supervise the 90 plus healthcare providers that are part of the COVID vaccine distribution program here in Snohomish County.
Okay, thank you.
Mm-hmm.
We had a question for Dr. Spitters. Ed had asked, why is the vaccine rate for Snohomish County among the lowest in Puget Sound?
Yeah. Well, first, overall, I think Sean showed about 14% of the county population has had 1 or more doses. And the difference, I haven't looked, in recent days, but the difference across counties is like within 1 percentage point. And so that's part of it. The other is that our per capita 1A population is pretty low. So early on in the 1A, like if you look at King County, they have a healthcare industry there, that's referral centers and all that. So and I think Pierce County has more 1A eligible people per capita than Snohomish County. So we got off to a slow start just because of that, because the proportion of our population that was eligible was just smaller. And we've been catching up with the allocations since then as we moved into 1B1, but we're somewhat still in catch-up mode. But we're doing everything we can to get the vaccine out, and respectfully, we're not in a race with the neighbors. We're in a race with the virus, and so we'll continue that.
Megan, could I just say a word that we started planning for vaccinations in July, and we've had from day one more capacity to give shots than we've had actual vaccine doses. And we are at the mercy of the state and the federal government for how much vaccine we are getting. So early on, we got a slow start in terms of our supply, but we're catching up. We've made a lot of noise about it. And so any differences are not related to our ability here in Snohomish County that we've stood up to actually give vaccinations. That capacity is there and ready.
Thank you. Dr. Spitters, we had another question from Beth, who asked, she had asked, how close are we to moving to the state's phase 1B tier 2? And you had said several weeks in your presentation. So the next tier includes ages 16 to 24, which seems like a huge number of people. So how will older people be prioritized over younger people in that phase, or how will we move into that next phase?
Right. So 1B1 is, as you said, is older adults above 65 and up, and some folks 50 to 64 with specific living circumstances that I won't go into the details. The next group are individuals 16 to 64 who have 2 or more chronic medical conditions listed by CDC as risk factors for severe COVID. That is a bigger number, and speaks to the point of timing the transition appropriately. You know, we don't want to wait forever. We can't wait till we get everybody done, or we'll waste a lot of time. But we do want to, I think, reach diminishing returns for the very reason that the question alludes to. We don't want to see you know, frankly, younger populations who by and large as a group are going to compete better for limited spots than older folks who have limited fluency or access to those information technology media that are needed. So, you know, we'll continue the efforts that Jason has mentioned to try to help older adults, but timing is key. And I've certainly mentioned this several times to the state, is, you know, we're likely to go either as a region or a state from 1B1 to 1B2. So that will largely be driven by the state health department. And we just want it to be soon enough that we don't lose time wasting, you know, open administration capacity, but at the same time, don't go so soon that there are still so many people left from 1B1 that they get lost in the shuffle. And of course, you know, as we go forward, there's also, whenever that time occurs, there is that option of trying to create a carve out, whether it's a space or a time or some preferred lane, if you will, that would prioritize the 1B1s over the 1B2s for those who are still in 1B1 and haven't gotten vaccinated.
Thank you. Jason, did you have something to add?
Yeah, I was just going to add exactly what Dr. Spitter said, is that we are looking at within our planning how we can establish either specific hours, specific days, or specific lanes for folks. And I'd be remiss if I didn't mention, you know, with the partnership of a lot of the fire agencies, they are actually going out to residential areas like the adult family homes and other places to provide vaccines out in the communities. We know it takes a while, and obviously we have to have the vaccine to do it, but we have been looking at that in anticipation of the phasing getting broader.
Thank you. Well, we wanted to cover as much as possible with the presentation. So if your question wasn't answered or you still have questions, you can email them to my office to Paula Rhine, which is paula.rhyne@snoco.org, or you can contact the call center. And we've got helpful links up there. So you can also contact the call center, and the number is 425-339-5278. So those are during business hours for Monday through Friday, 8:30 to 4:30. In closing, I'm sorry but we've run out of time. So thank you to our co-hosts and our panelists, including Executive Summers, Chair Wright, Dr. Spitters, Sean, Jason, Rochelle, and everyone who sent in questions. And then also to all the people who help behind the scenes. Our goal is to distribute the vaccine to everyone as quickly as possible, and we won't leave anyone behind. So we're working to make sure everyone can get an appointment and get their vaccine. We thank you for your patience as we work on this, which is hopefully a once in a lifetime pandemic response. And I thank everyone for joining tonight. And thank you and good night. And thank you to Eric. Good.